Good afternoon, everyone, and welcome to today's conversation with Cove and the Pill Club. My name is Victoria Moorhouse. I'm a health and beauty writer, and I'm so excited to be joining you as the moderator for this event. Today, we are going to be talking about the connection between menstruation, migraines, and birth control. According to the Office on Women's Health, it's reported that 29.5 Americans suffer from migraines. It's also estimated that 3 out of 4 people who have migraines are women. Many also observe a correlation with their migraines and their menstrual cycles. We may actually have a number of people on this call right now who suffer from menstrual migraines. And hopefully this panel answers some of your questions and gives you some of the information you need to better handle your symptoms. Before we get started, I'd like to go over a few housekeeping items so that you know how to participate in today's event. Prior to this event, the Pill Club asked its Instagram followers what questions they had about menstrual migraines, which we'll pepper in throughout the conversation today. That said, we hope that you ask any questions that you have throughout the panel as well. At any time during the panel, you'll have the opportunity to submit your questions to the presenters. To do so, just type your question in the Q&A at the bottom of your screen on the Zoom control panel. As time allows, the presenters will address as many questions as they can during the Q&A segment at the end of the presentation. I do also want to note that Dr. Roskin and Dr. Crystal, our panelists, cannot give any personal diagnoses or answer any questions to your personal medical history. So while asking questions, please frame your questions in general terms. And finally, we will be recording this webinar and we will share the link after the event. Feel free to share this with the people in your life who struggle with menstrual migraines as well. Without further ado, I'd like to now introduce Dr. Sara Crystal from Cove, an online migraine clinic, and Dr. Amy Roskin from the Pill Club, an online medical practice that specializes in contraceptive and women's health. Dr. Crystal, over to you to tell our audience about yourself.
Hi, everyone. Thank you so much for joining. I'm really excited to be talking about this topic today. I'm a neurologist and headache specialist, as well as a fellow migraine sufferer. And I know menstrual migraine can be really tough. And as Victoria pointed out, migraine is really common. 1 in 5 women in this country have migraine, and many notice worsening around their menses. So super excited to be here. And over to you, Dr. Roskin.
Thank you, Dr. Crystal. I'm Dr. Amy Roskin. I'm a board-certified OBGYN, and I'm the Chief Medical Officer of the Pill Club. I'm really happy to be here today and looking forward to answering your questions that might come up. Thanks.
Thank you both so much for joining us. So we've organized today's conversation into a few key themes, one of which is hormones and headaches. The second is birth control and migraines. And then the third is how to manage migraines. So I have some questions prepared for our panelists, but before we dive in, let's start with helping everyone here understand what a migraine actually feels like. So Dr. Crystal, how would you explain what a migraine feels like to someone who's maybe unsure if they've ever had one?
Sure. So a migraine is maybe different from a typical headache. Almost everyone in their lifetime is going to get, a regular tension type headache, but a migraine tends to be more severe. It's often one-sided. The pain is usually described as throbbing or pulsating, and it's often accompanied by nausea, vomiting, and sensitivity to light and sound. About a quarter of people with migraine experience aura, usually a visual aura, which people describe as flashing lights or lightning sparks, that sort of thing, that usually comes before a migraine. But it's kind of a misconception to think that if you don't have aura, you don't have migraine, because most people actually don't.
Got it. Thank you. So that's kind of a great segue into our next question, which is what exactly is a migraine? So could you define maybe the phrase of what a migraine really is?
Yeah. So a migraine is it's a whole brain attack. So a lot is going on in the brain during a migraine. So people with migraine it's usually genetic. Different triggers can cause a migraine attack to occur in somebody that has that genetic tendency generally. And when that happens, vessels in the brain dilate and different proteins get released, and some of those act on structures in the brain that are pain sensitive, and that causes the whole cascade of migraine symptoms.
Thank you. So the next question is for Dr. Roskin. What is the relationship between hormones and headaches in women? How do they relate? How do they come together?
Well, that is a really important issue. And we do see that hormones and headaches are related, and they can be related in direct ways, but also in complex ways. For example, the two main hormones produced by the ovary would be estrogen and progesterone. And it does look like that estrogen can be associated with headaches in women. And this is one of the things we'll get into shortly relating to menstrual migraines. So in some people, increases in estrogen, whether from your natural hormone cycles or from using hormonal contraceptives, can be associated with headaches, especially for purposes of this discussion, migraines, but also other types of headaches. But also it's important to note that in some patients and some people, a decrease in estrogen can also trigger headaches. So that's why it can be kind of confusing, and why it's really important to try to figure out what exactly is going on so we can get people the best treatment and best relief possible for this.
Definitely. Thanks, Dr. Roskin. So our next question, is there a difference between migraine headaches triggered by hormones and other types of migraines? Dr. Crystal, can you answer this one?
Sure. So menstrual migraines in particular tend to be a little more severe. They can last longer and also be a little more resistant to typical medications that may work for someone at other points in the month. The menstrual migraines generally tend to occur anywhere between 2 days before and 3 days into the menstrual cycle.
Okay, so then one thing I wanted to ask is, we often hear people use the phrases menstrual migraines and hormonal headaches interchangeably. Are those actually the same thing?
Well, menstrual migraines would be, an example of a migraine that's triggered by hormone changes, but other hormone changes that can trigger migraines include pregnancy, menopause and perimenopause, as well as some birth control in some instances.
Okay, that makes sense. So before we move on to all things birth control and migraines, we do have one last question that someone from Instagram had sent through. It's a great question. If someone is experiencing menstrual migraines, should they tell their parents or their doctors? Is this something they should be bringing up with a healthcare provider?
I would say definitely yes, because there are ways we can help for sure.
Awesome, thank you. So moving on to our second segment, which is birth control and migraines. Dr. Roskin, many of us on this call have heard various takes on the role that birth control can play in managing menstrual migraines. We're really happy to have an expert in the room who can explain this to us. So let's start with whether birth control helps relieve migraine attacks, and what types of birth control can do this.
Thanks, Victoria. That's a great question, and it's also kind of a complicated question. So for purposes of this discussion, I'm going to limit it to migraines without aura. So if someone is suffering from estrogen-related headaches, like especially at the middle of their cycle, or estrogen can sometimes be responsible for a headache associated with like a menstrual migraine. in those particular cases, I think birth control that contains estrogen can be helpful, because when you think about it, it's these changes, it's the peaks and the troughs of the estrogen that may be triggering the migraines without aura in this person. And so if you're taking something like a combination estrogen and progesterone containing birth control pill, that can kind of stabilize things in that you get the same amount of estrogen in your system each day. And I've often found it helpful when people have menstrual migraines. I often recommend that they take the birth control pill continuously. That is, don't take the placebos either for that week or for that 4 days. And they do often better with an extended cycle pill. That way they don't have the elevated and the decreases in estrogen. And some people often find relief with that. So in this particular case, for example, relating back to your question about what types of birth control can help, I think a combination birth control pill for this particular situation might be very helpful.
Okay. And is that, with your answer, is that a reason like it could help? Is that a reason also maybe why you should bring up this symptom with your doctor, maybe at your annual appointment or with your OBGYN? Is that something that you should also discuss as you're talking about other things?
Absolutely, because it can be complicated, just like I said, where it can be from high levels of estrogen, it could be from low levels of estrogen, it could be from changes in estrogen. So it's really important to let your healthcare provider know, and we can work with you to find the best solution for you. I think in some cases, birth control can even cause migraines, so it can be even more complicated than that. So really, we have to take it case by case and treat people as individuals. And then this really leads to a better treatment result.
Okay. And so you actually mentioned something that was one of my next questions, which was, can birth control cause a migraine?
It can in some people, and this can be concerning, for example, based on the severity of the headache, or if they develop migraine headaches with aura, that can be, a significant warning sign.
Okay. How would one know if your birth control is causing your migraine headaches? Are there warning signs, or are there anything that you should note?
Yes, exactly that. I think it's really helpful to think about situations and triggers and timing. For example, if you were never on hormonal birth control previously and you started it last month, and you're telling your healthcare provider that you're having these headaches and they started about, a month ago, or they're started in close proximity to the time where you started birth control, that can be, to me, that might be evidence that the birth control is causing these headaches. So by the same token, if you then stop the birth control and you notice you never get that type of headache again, then we can use that to help us decide what could have been the cause of it.
Okay. My next question is something that you had touched on previously, but maybe for someone who just joined or, didn't hear that part, I'd love to kind of discuss that again. Are there certain types of migraines that don't mesh well with birth control?
Sure, that is a really important point and potentially a really significant safety issue. I think Dr. Crystal really effectively explained what a migraine with aura is. And so from our point of view as healthcare providers, there is a big difference with hormonal contraception, whether you have, especially estrogen containing hormone contraception, whether you have migraines with aura or migraines without aura. For a person who has migraines with aura, in most cases, it can be dangerous to use an estrogen containing hormonal contraceptive. That's because estrogen has some almost like a blood thickening effect. It's a minor effect, but it does increase the risk of stroke, which can be a very severe and devastating side effect. And it's felt that migraine with aura may also be associated with a slightly increased risk of stroke. So we really don't want to add these two risk factors together. And so for the most part, if someone has migraines with aura, I like to try to find a non-estrogen containing birth control option for them. The good news is that there are plenty of those. We have birth control pills that have no estrogen, that are progestin only, implants, IUDs. There are other forms of birth control that I think would probably be a better choice from a safety standpoint for someone with migraines with aura.
Okay, great. Thank you so much. So, moving on to our next segment, and this is really just how to help manage migraines. Now that we've covered this relationship with birth control and migraines, I'd like to turn to you, Dr. Crystal, for a few final questions before we jump into our Q&A segment where our viewers will be able to ask their questions. So before we get into how to manage menstrual migraines, can you help our audience understand what the typical symptoms of a menstrual migraine would be?
Sure. So similar to regular migraine symptoms, but often more severe, longer lasting, and a little harder to treat. But the one-sided headache, the throbbing, the light and sound sensitivity that goes along with it, nausea. Again, as strictly defined, it usually occurs anywhere between 2 days before, 3 days into the cycle, and that's where it gets a little tricky because you may not even have your period yet, but you're getting that menstrual migraine, and sometimes people can tell right away from that quality of the headache that it is, they realize, oh, that's my period coming.
Okay. And so like if you're experiencing these what you think is a menstrual migraine, and you're not sure, like kind of what you said, like maybe your period isn't around yet, like, is this something that you should maybe like note? Do you recommend keeping a migraine diary to identify triggers and patterns, or,
Yeah,
something that,
absolutely. Yeah, sorry, absolutely. That this is where a diary is extremely helpful. If your headaches start the same day as your period, then it's easy to put it together. But the thing about menstrual migraine is that because it's so tough to treat, the most important thing is to prevent it. So if you can actually get a day ahead of it, and prevent it entirely, you'll be that much better off. So for example, let's say you start a placebo pill on Sunday, and your period comes on Tuesday, but your headache usually starts on Monday, the day before your period even starts. You can maybe take something preemptively when you start your placebo pill. But that's where keeping track of everything is so important. And the other thing is, some people have certain triggers that are absolute no-nos for them, like alcohol, but for other people that same trigger might be okay certain times, but it's when it's maybe you don't want to be playing around during your period week, or so when you see your periods coming, that's when you're going to be extra careful about reducing stress, about avoiding those other triggers that are maybe sometimes okay.
I have a few more questions for you, Dr. Crystal, but you had said something, when we were talking about the diary. I'm curious, like, what types of things should you be noting if you were someone who was interested in that? Like, what are the things, like time of day? Is there anything you should kind of keep track of?
Sure. It's helpful to, of course, your mark your cycle, where you are in your cycle, as well as other things that are going on, extra stress that might be going on, other, if you drank alcohol, if you ate something a little bit out of the ordinary of your usual diet, those sorts of things can be helpful.
Great. So outside of birth control, I know we talked about how birth control can help, or, sometimes it can cause. What are some other wellness practices that one can incorporate into their daily life, or, their regular life to mitigate menstrual migraines?
Sure. So some of the things that are helpful in general for migraine are increasing aerobic exercise, reducing stress, and then some natural products that have been found to be beneficial, or supplements. The one with the most evidence is probably magnesium. And interestingly, people with migraine tend to have lower levels of magnesium, and people with PMS symptoms. So yeah, supplementing magnesium throughout the month ideally, but especially around your menstrual period can be helpful. And usually you can't get enough from your diet, so that an extra supplement can be beneficial.
Okay, thank you. This was a question that we had received, but for those who are interested in managing migraines without medication, what would you suggest?
So other than the supplements, other things that help are, sometimes some essential oils can be helpful. Things, ones that have benefit during an attack are lavender and chamomile in particular, and peppermint or menthol. Um, some people find ice beneficial. Some people find heat more beneficial. Um, and of course, as far more as more of a preventive, but staying very well hydrated is important as well.
Okay, great. And it kind of sounds like, when you were saying like some people, this might be helpful, some people, is it kind of all individual?
It really is. There are some things that we know are helpful across the board, but triggers are very individual. So, telling somebody that cut all this out of your diet isn't necessarily beneficial. That's where the diary, it becomes so important to find out what your specific triggers are. I do want to mention also, as far as non-medication approaches, this is a recent study that found that diet supplementing omega-3 is very beneficial for migraine sufferers.
Awesome, thank you. So we are going to move on to our Q&A segment. So if you have questions, please feel free to submit them in the Q&A session, little control panel at the bottom of the screen. So I'm going to ask the first question. Angela, thank you so much for submitting one of our first questions. To address your question without asking Dr. Roskin and Dr. Crystal to tread into medical advice territory, I've reframed it just a little bit. For individuals who have been on their current form of birth control for a couple of years and are just now starting to see migraine symptoms at the start of their cycles, what could be causing something like this? Dr. Roskin, this one is right up your alley.
Sure. So remember that these things can be additive. So I would say, obviously, if you've been on the same specific birth control for years and that hasn't changed, then maybe other things have changed, whether, as Dr. Crystal pointed out, you have other triggers, other things that are also contributing to this. But that being said, I don't think that it's necessary to not change anything with your birth control. For example, if you notice that when you're not, if someone were to notice that when they weren't taking an estrogen-containing birth control pill and their estrogen level would fall, hypothetically, I think that person might still benefit from using pills continuously so you don't get a cycle, so that you can just have that stable estrogen level daily and see if that helped. If that doesn't help, then yeah, maybe we're dealing with something that's not either hormone related or not sensitive to treatment by changing the hormones.
Thank you, Dr. Roskin.
Sure.
Our second question comes from Caitlin. Is it possible to develop migraine issues even if you've been on birth control for many years? This might be another one for you, Dr. Roskin, but please feel free to weigh in as well, Dr. Crystal.
Yes, this question is, again, they've been on a birth control methodology for some time and are now developing migraines.
Yes, like if you've been on birth control for many years, is it possible to then develop it later?
It is. And I mean, it's confusing because what has changed, but I find that sometimes if you think of it, if for a particular person, the birth control that you're on, and let's just for purposes of the example, say someone is on a combination birth control pill that has estrogen and progesterone, they've been on that for years, and now they develop migraine symptoms. Again, it's not necessarily that the birth control pill caused that, but it may be a contributing factor. So this is again where Dr. Crystal really stressed the importance of that migraine diary to help track other factors that may be contributing to it. So I think one strategy is to try those non-medical treatments, see if you get relief from either supplements or changing your exercise program or using any of these other things, including other medications. But again, I do think it's reasonable to also try adjusting that birth control, because sometimes over time, what used to work for you may not be a good fit due to a variety of factors. And again, everybody's an individual, so these are the kind of things we would have to take into account. You look at the whole picture of what's changed over time and what's still working for you and what might not be working for you. So I think it's possible that it's a contributing factor. And so you can consider adjusting it based on that.
I think that that's such a good point that you said too. Just, it might not be, it might have worked then, but it might not be working for you now. So, another reason to bring up your concerns with your doctor.
Absolutely.
So this is another great question. Again, for you, Dr. Roskin, if you mess up your birth control cadence, for example, you forget to take out a NuvaRing or skip a day on the pill, are you more likely to get a migraine?
Well, that depends. So I would say that the majority of people don't have that particular sensitivity, in that for most people, if they miss a pill, they don't immediately get a headache or a migraine, but some people do. And so for those in those situations, it might be contributing. But remember, not everybody gets menstrual migraines. The majority of people are fortunate enough not to suffer from that. So while, again, it's something to consider, but it's not something to worry about if you don't have that particular symptom. Now, if you know that you're sensitive and you know that if you miss a pill, boom, you're going to get a headache, then it's super important to take your pill regularly to make sure that you maintain that stable level of hormones.
Thank you. So, Dr. Crystal, this question is for you. Are there any other newer treatment options besides the usual rescue meds like triptans?
Yes. So the last 3 years have seen an explosion of migraine treatments, whereas not much happened, from the time sumatriptan was developed about 30 years ago till about 2018. From then on, we've seen many different treatment options, including for the first time migraine specific preventives. So prior to a couple of years ago, the only options we had for migraine prevention were medications developed for other medical conditions like beta blockers for blood pressure, topiramate, an anti-seizure medication, and the antidepressants. So now we have medications that target CGRP, which is a protein that's elevated during migraine attacks, and people with migraine have elevated levels of CGRP. So we now have both preventive options, including monthly injectables, every other day pills, daily pills that target CGRP for migraine prevention, as well as acute migraine treatments that also work on the system. These are called GPANs, and they are often much better tolerated than triptans. So many different options. If you haven't done well with treatments in the past, it's definitely worth visiting a doctor, because there's a lot of new options.
That's great. So I'd love to hear from both of you for this question from Hillary. How would one know if they have too much hormones or are deficient that might be causing menstrual migraines?
Well, I think unfortunately, there's not a simple test where you can check a particular level of a particular hormone and define a deficiency that's triggering that symptom. It's actually a more subjective thing. That if you look at two individuals, one who suffered from menstrual migraines because of the withdrawal or decrease in estrogen levels, if you check those people's estrogen levels, they could be identical, and yet one person might have significant symptoms and one person might not. That's why I think it's so important to treat the whole person and not just a lab result. So just to summarize, a hormone test won't, I think, really lead you to know whether you're deficient. I think that's something we would judge based on your symptoms.
And Dr. Crystal, if you have anything to add, I can repeat the question as well if you'd like.
No, I agree. I mean, also there's no specific test, for migraine specifically, but yeah, it's always a matter of like looking at the whole picture.
Okay, so our next question brings age into the conversation. Is there an age-based component to when someone might start to develop menstrual migraines? What a great question. Dr. Amy, let's start with you, and then we'll kick it over to Dr. Crystal for additional thoughts.
I'm not aware of a specific age-related risk factor, although I will say that other age-related events can contribute to it, and also, fortunately, to the resolution of menstrual migraines. For example, although the perimenopausal period, which is a time of significant hormonal fluctuations, that can be associated with menstrual migraines for many people. Once you transition through menopause and the estrogen level is consistently low, then many people find relief of their symptoms. So hopefully if that provides some light at the end of the tunnel for some people, that would be a good thing.
Not much to add. For many women, the onset of puberty is the time when migraines start. In boys, it's actually even younger, but that's the typical time that migraines start. So it's very much tied to estrogen. And interestingly, even in elder migraine is even more common in elderly women than men, despite being many years after menopause. So there's definitely this tie-in, but it's true. Yes, certainly some women experience improvement. The majority of women experience improvement when they go through natural menopause, when they finally get there. And pregnancy also is a time of relief for many women, particularly the second and third trimesters.
So Dr. Crystal, we have another question for you to follow on that question. If migraines become common in, say, your mid-40s, is it expected for them to worsen with perimenopause and menopause?
Yeah, so when migraines start in the mid-40s, some people go through perimenopause that early, so that could be what's going on. It's hard to say if that a particular person will worsen in perimenopause, but typically women that have menstrual migraine will overall do better in menopause.
Okay, great. Dr. Roskin, do you have any tips for hormonal migraine sufferers who are trying to conceive and therefore unable to take medicine?
Yeah, that is really a challenge, and thank you for your question. It's always really difficult to know how to utilize medications because we don't really conduct studies on pregnant people to see if these things are safe. So there's very little data. So I think the best thing you can do is be really rigorous about having a symptom diary and be very vigilant about what your triggers might be and utilize any and all other methods you can to help to control those, whether it's things like the exercise, supplements, things like that. I think those really become even more important with a situation like that. But it is a problem, that we can't, and that's just some of the limitations of our science.
Another question came in. This is for you, Dr. Crystal. What is the science behind the symptoms of a migraine?
Right. So that's an interesting question. So a lot is going on in the brain during a migraine. It's kind of like a whole brain party, but not in a good way. But we used to think that the pain of migraine is just due to vessel dilation, and that pulls on nerves, and that's what caused. So that was like the vascular theory of migraine. But we realized that that's just part of what's going on in migraine. So vessels do dilate, and the triptans constrict vessels temporarily and give relief. But when vessels dilate, there's also a whole bunch of these inflammatory proteins that get released and act on different parts of the brain. People with aura, their headaches, the aura start in the occipital lobe of the brain, and then there's this excitatory wave. And then this wave of depression, this whole, it's all electrical activity going on in the brain during a migraine, and where it spreads and activates certain parts of the brain, like the brainstem. That's where the majority of what's going on in migraine is happening. And then that activates the nerves that sense pain and cause the pain of the migraine, as well as the light sensitivity and sound sensitivity.
Thank you, Dr. Crystal. This is an interesting question. Is it common for someone on a combination birth control to get migraines during the placebo week? Dr. Amy, let's start with you for this question.
That's a great question. And we do see that because when you think about it, if someone is very sensitive to a decreased level of estrogen, they've been on the pill for the month with those hormonally active tablets, and then they get to the placebo week where those pills don't have any hormones. So I think that definitely would be a situation for someone who's sensitive to estrogen decrease, or sometimes called estrogen withdrawal, to get a migraine in that situation. Again, one of the treatment options might be to use the birth control pills continuously. But again, that would apply to migraines without aura. I think if you're having migraines with aura, you really need to be very careful about utilizing estrogen-containing hormonal contraceptives.
Okay, so that actually leads into another question we have is, I was wondering if we could describe what aura means again, like what exactly is an aura with a migraine?
Sure, I can explain. So aura is defined as reversible neurologic symptoms, meaning reversible, meaning that it's not like a stroke, which is a permanent, deficit. It's a deficit that lasts a short period, typically between 5 minutes and half an hour, sometimes up to an hour. The most common aura is visual aura. And usually people describe these either flashing lights. Some people say it's like a photo flash goes off, that sort of thing. Often it starts in the peripheral vision and moves across. It can obstruct your vision partially. Or some people experience more of a darkening of their vision or obstruction of partial part of their vision. Typically when the aura ends, that's when the pain of the migraine starts. Less common aura types are sensory auras, and this is usually tingling, but can be numbness or a combination. And unlike, let's say, a stroke, which just happens in a second, somebody goes, let's say, numb on half their body, it's sort of a gradual progression, can start in the hands and kind of march its way up to the face. Again, it can be a combination of like pins and needles and numbness or just numbness. And then the least common type of aura would be a speech disturbance where you can't get the words out. That can be really scary to people because they really do think they're having a stroke. And of course, if you're experiencing a different aura than usual, you should definitely talk to your doctor about it.
Thank you for that. So I'm sure people, may be unsure what an aura is as it relates to migraines. Our next question is also for you, Dr. Crystal. I've had severe migraines once a month for 2 years now without any treatment. What supplements, home treatments would you recommend for someone to try to start using?
Sure. So again, some of the supplements that are helpful are magnesium. Other ones that we didn't mention are riboflavin or B2, and coenzyme Q10 is also helpful. These are generally taken daily to help prevent migraine. Other treatments that are helpful are acupuncture, biofeedback. These are all things with good evidence behind them. But of course, if you're having severe headaches once a month, first of all, try to see what is the pattern. Is that once a month with your period? And then, certainly there are things that can be done for that, or is there some other trigger that you identify that you can address? But it's important if you have severe migraines and you don't respond to over-the-counter medications. You might not need a preventive prescription medication, but it's certainly very helpful to have a migraine-specific acute treatment. Most people with migraine, the over-the-counter medications don't work all that well.
Following one of the things that you were talking about, magnesium, what is the recommended daily dose of magnesium to prevent migraines?
Generally, we recommend 400 milligrams a day. Probably the cheapest and most widely available form is magnesium oxide, but that's also a little more likely to cause upset stomach or diarrhea. And, maybe a better tolerated, but a little more expensive form would be magnesium glycinate, but also a dose of 400 milligrams a day.
Thank you. So one of our attendees is 50 years old and has chronic migraine. The menstrual migraine is always the worst, and doesn't respond to treatment and makes, causes emergency room visits. Do you think it's worth taking progesterone?
It's hard to say without knowing more information about, someone's particular situation. But I would say in general, progesterone doesn't have the same stroke risk, for example, as estrogen. So I think I would be, less concerned about using that. Stroke risk increases over time. So the older you get, the more at risk you are for having a stroke. And that's why we try to gauge any sort of treatment with hormones or with any medication for that matter, based on the frequency or risk of side effects. So I think, I've seen people do well with progesterone supplements. Some people swear by them. Other people, again, it can be triggering for. So I think, it would be really important to rule out other causes and to have a full evaluation. But then I do think that's something that could be considered.
Thank you for answering that, Dr. Roskin. This is a good time to jump into this question. Do we know why progestin-only contraceptives can cause worsening migraine in the beginning, such as an IUD placement?
That's complicated. I'll give you a long no. We don't actually know the specific physiologic reasons why that might be. It's definitely something that's been described. And what we think it is, there's a complex interaction to the way these hormones cause changes in the brain, which Dr. Crystal described previously. So it's a very complicated cascade. And some people do find progesterone or any hormone can cause an increase in migraines. So if it's something that can be tolerated, then often that will balance out again with the same idea of it can be changes in hormones that cause these things, whether it's an increase or a decrease. And once your body adjusts to that new level of hormone, people often find a significant amount of relief with that. So hopefully that will be the situation there.
I'm muted.
Got it.
Thank you, Dr. Roskin. Dr. Crystal, this one is for you, and it is especially relevant with so many people working from home. Do you have any tips for workplace adaptations for management and prevention of migraine?
Sure. Yeah. So that's a great question. So at the beginning, when this all went down, a year and a half ago, and people started working from home like that, people were getting a lot more migraines. And of course, there's so many things that could be playing a role. But I found one sort of simple-ish thing was that just the workstation, people were kind of treating it as so temporarily that they, many people are just working on their couch, on their, the posture wasn't really something people are addressing. And I kind of really urge people to really look into an ergonomic workstation. So it doesn't necessarily need to be a sit to stand desk, but that can be helpful for some people. But make sure that look at ergonomic tips and make sure everything is set up the right way, that you're not straining your neck, which can trigger headaches. Similarly, make sure your lighting isn't irritating you. Just try to treat your home setup like a real office that that it probably is at this point.
Okay, great. Thank you so much. So that looks like our last questions. If anybody else has any other questions that they'd like to ask Dr. Roskin or Dr. Crystal, please feel free to send them in now. While we wait for maybe some last questions to come in. Dr. Roskin and Dr. Crystal, do you have any parting thoughts that you'd like to share before we part ways about menstrual migraines, birth control, and menstruation?
Sure, I'll go. So yeah, I was really excited to talk about this because, migraines very common, menstrual migraines very common, and it can be, pretty disabling. So yeah, hopefully people were able to glean some good tips, and just know, please reach out to your doctor if you're suffering, because there are a lot of things that we can help with.
Well, I'd just like to thank Victoria, Dr. Crystal, the teams at Cove and at the Pill Club for making this event possible. And I especially want to shout out all the people who came together to participate in the conversation. I'm really looking forward to continuing this dialogue and continuing to learn from you. I hope you found this helpful, and I know that together we can find more effective ways to manage this condition.
Oh, we have one more question. Thank you, Dr. Roskin. Is there any significance behind sodium channels and migraines? Dr. Crystal, this one might be for you.
So probably, yeah. I mean, some of the medications that we use do target sodium channels, among other things. Some of the medications, we actually don't even, like some of the anti-seizure medications, we don't know exactly how they work for migraine, but some do affect sodium channels.
Perfect. Thank you so much. Thank you to both of our panelists. This was so informative. I learned so much, and I want to thank you so much for taking the time to chat with us all. Remember, if you're looking to connect with a doctor for help, you can always visit the Pill Club at thepillclub.com, and Cove with Cove/Zoom for 50% off your first order. And that is it for us. We hope that this was helpful and educational for all of you. If you joined late or missed any of today's discussion, you can check this out on the Pill Club and Cove's YouTube and social channels soon. Before we go, again, I want to say a big thank you again to you, Dr. Roskin and Dr. Crystal, for taking the time to join us today and answer these great questions. And also thank you so much to everyone who shared their questions and tuned in with us. And if you have any other questions, feel free to reach out to Cove and the Pill Club directly through DMs. So thank you all so much. This was wonderful. Bye, everyone, and take care.
Thank you.
Bye-bye.